Introduction. You may have heard that oral collagen supplements can help your skin or joints. But what about your eyes? In glaucoma filtering surgery, such as trabeculectomy, a tiny drainage blister called a bleb is created under the conjunctiva to lower eye pressure. For the bleb to work, it needs just enough healing to seal the surgical wound, but not so much scar tissue that fluid flow is blocked. This article explores whether taking collagen or pro-collagen supplements could fuel extra scar formation, fibrosis, in the bleb area, potentially harming its function. We'll explain how normal wound healing works, what we know about collagen supplements and scarring, and practical advice on timing and safe doses if you have a bleb. We'll also suggest ways researchers could measure bleb health in future studies. Wound healing after glaucoma surgery. After glaucoma surgery, the body repairs the cut tissues through a well-known sequence of steps. First, a blood clot forms to stop bleeding, hemostasis. Next comes inflammation. Immune cells rush in to clean out debris and bacteria. Then the proliferative phase begins. Special healing cells called fibroblasts multiply and start to rebuild the tissue by laying down new collagen fibers and other components, forming granulation tissue. Finally, in the remodeling phase, the new tissue matures and strengthens over weeks to months. In a trabeculectomy bleb, this process is similar but must be tightly controlled. The conjunctiva and Tenon's capsule heal and may form scar tissue. If too much collagen and scar form under the bleb, it blocks the new drainage channel. In fact, scarring is the single most common cause of bleb failure. For example, one review describes the 4 key stages of bleb wound healing: clot, inflammation, proliferation, remodeling, and warns that when dysregulated, healing can lead to excessive subconjunctival fibrosis and surgical failure. In practice, surgeons work hard to limit fibroblast activity in the early weeks after surgery, often using anti-scarring drugs so that the bleb remains open. Patients may also see a brief rise in eye pressure in the weeks after surgery, a normal result of the healing process peaking, often around 4 to 8 weeks before settling down. Collagen Supplements 101. Collagen is the protein that gives structure to skin, bones, tendons, and many tissues around the body, including the eye's sclera and conjunctiva. Collagen peptides are small pieces of collagen that are often sold as powders or pills touted for skin and joint health. When you ingest hydrolyzed collagen, the common supplement form, your gut breaks it down into amino acids and tiny peptide fragments. It is not taken up as intact collagen fibers. In fact, most trials on collagen supplements use doses around 2.5 to 10 grams per day. These peptides then circulate in your blood at very low levels. Some remain bioactive. For example, short collagen-derived peptides like ProHype or HypeGly can sometimes be detected in the blood after a few hours. Studies in healthy adults suggest that collagen supplements are quite safe. One summary notes that daily doses up to about 15 grams may be safe and effective, and that collagen is generally a safe, non-toxic supplement. Typical side effects at high doses are mild, things like stomach bloating, fullness, or loose stools. Serious complications are very rare. To put this in perspective, one nutrition source notes that supplemental collagen has no official daily requirement, but common trial doses range from 2.5 up to about 10 to 15 grams per day. As always, if you take collagen supplements, follow the product's instructions and talk to your doctor, especially if you have any health conditions or take medications. For instance, protein supplements can interfere with thyroid medicine absorption. Collagen peptides and fibroblast activation. How might collagen supplements affect wound healing? Experiments suggest that collagen-derived peptides can signal fibroblasts to lay down more matrix. In lab studies, exposing human skin fibroblasts to collagen peptides led them to make more collagen and related proteins. Another review notes that collagen peptides can stimulate cell pathways. They may stimulate collagen synthesis and regulate inflammation and extracellular matrix remodeling. In simpler terms, these small peptides can act like a mild biochemical alert that encourages fibroblasts to build more connective tissue in wounds. Practically speaking, when you take collagen supplements, only a tiny fraction of those peptides ever reach tissues intact. There is no targeted delivery to the eye. However, because bleb success depends on limiting fibroblast-driven scarring, Many experts caution that any general booster of collagen production could, in theory, accelerate unwanted fibrosis in the bleb. Indeed, eye doctors often try to suppress strong fibroblast signals. For example, they sometimes inject agents like 5-fluorouracil or mitomycin C at surgery to kill off some fibroblasts and prevent scar tissue formation in the bleb. To be clear, no study has directly tested collagen supplements after bleb surgery. But given that collagen peptides seem to promote healing in wounds elsewhere, it is biologically plausible they could speed scarring in the bleb. Collagen and wound healing, human evidence. Collagen supplements have shown benefits in other wounds. For instance, in randomized trials of chronic pressure ulcers, patients given collagen hydrolysates healed faster. One study, 120 patients, found a high dipeptide collagen drink, 10 grams per day, significantly improved ulcer healing scores and reduced wound area versus placebo. Similarly, in burn victims, high doses of collagen, up to 40 grams per day in one trial, led to faster wound closure and better scar scores. These human studies support the idea that collagen promotes faster healing and stronger new tissue formation in skin wounds. This evidence cuts both ways. On the one hand, it confirms that collagen supplements can meaningfully boost the body's repair processes in obvious wounds. But on the other hand, a filtering bleb is a special type of wound, one where the goal is to keep some space open for fluid flow. Too rapid or excessive healing equals failure. Because the available human data, pressure ulcers, burns, consistently show more collagen leads to better healing, some clinicians speculate collagen supplements could theoretically cause excessive scarring in a bleb. No trial has followed glaucoma patients taking oral collagen, so the risk remains theoretical. As one patient support site notes, people are often told after glaucoma surgery to avoid high collagen foods in the first months, e.g. bone broths, pork trotters, fish concentrates, with the idea that a fast-healing diet might close the bleb's drainage too quickly. This advice has not been rigorously studied, but it reflects the same concern. Timing. When to take collagen supplements. If you have a new filtering bleb, timing is everything. The first month or two after surgery are when fibroblasts are most active. One glaucoma specialist described how scar tissue in a bleb often peaks around 6 to 9 weeks after surgery in many patients. During this time, bleb resistance to outflow is high, the pressure hump, but usually settles as healing matures. By about 3 months, the bleb typically has matured. The initial burst of scarring has passed, and the tissue has begun remodeling. Given this, a cautious approach would be to delay collagen supplements until the bleb is well past the active healing phase. Many eye surgeons advise patients to avoid any pro-healing supplements or confusing diets for at least 3 months post-op. In practice, waiting even longer, 4 to 6 months, may be chosen, especially if bleb function is borderline. The idea is to protect the bleb during its most vulnerable remodeling stage. After that period of bleb maturation, ordinary collagen intake as part of a normal diet is unlikely to cause harm. In short, treat collagen supplements like any other wound healer. Hold off in the crucial early months until the bleb is stable. Safe dosage and upper limits. When you do start or resume collagen supplements, what dose is safe? Most clinical trials on skin or joint benefits use 2.5 to 10 grams per day for at least 2 to 3 months. Health sources generally agree that doses in this range are safe for most adults. In fact, one article notes that up to 15 grams daily has been used effectively, and a nutrition review even mentions a safe upper intake as high as 40 grams per day, though such high amounts are rarely needed or practical. The bottom line, there is no formal RDA for collagen, but studies suggest benefits often appear around 5 to 10 grams per day, and side effects are minimal. Possible mild side effects include stomach discomfort or diarrhea. If you consume large collagen supplements continuously, monitor yourself for any unusual symptoms, e.g. digestion issues, rashes, and stay within recommended doses. In particular, people with fish or other animal allergies should choose hypoallergenic sources if needed. Always check with your doctor about any new supplement. Monitoring bleb health in research. If researchers wanted to study this in glaucoma patients, they'd need good ways to measure blebs over time. Clinically, doctors look at bleb appearance, height, area, and redness vascularity. under the slit lamp and monitor eye pressure. One standard is the Moorfield's bleb grading system, which scores bleb height and vascularity in different zones. In research settings, they also use imaging tools, anterior segment optical coherence tomography, ASOCT, and ultrasound biomicroscopy, UBM. These can see inside the bleb without touching it. For example, studies have shown that functioning blebs tend to have fluid-filled cavities and a thin, clear wall on OCT, whereas failed blebs have dense, highly reflective scar tissue. In one clinical study, worse OCT bleb grade, denser wall, correlated with lower bleb height and higher intraocular pressure. Future bleb studies could track endpoints such as bleb wall thickness, internal microcysts, and fluid pockets on ASOCT UBM, along with clinical pressure outcomes. A study might measure bleb imaging and compare people taking collagen supplements versus not. Functional endpoints would include bleb survival, keeping target pressure without extra medications, and need for additional interventions. Together, these measures would reveal if collagen supplements truly harmed bleb function over time. Conclusion. In summary, while collagen peptides are generally good for skin and joints, their effect on a surgical bleb is a special case. No human study has proven harm, but the mechanism of wound healing suggests caution. Collagen supplements aim to boost tissue repair, whereas a bleb needs a careful balance of healing. The safest strategy, until more is known, is to hold off on collagen supplements for the first few months after glaucoma surgery, when scar formation peaks. If you and your doctor decide it's okay later on, moderate typical doses, 5 to 10 grams per day, appear safe. Always monitor your eye exam and pressure, and report any bleb changes. In future, researchers may use bleb imaging, OCT or ultrasound, and graded bleb assessments to study this question rigorously. For now, be sure your glaucoma specialist knows all supplements you take and follow their guidance on the timing of any collagen or healing-promoting products. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.